Vaccine passports are causing a big stir and unfortunately becoming politicized like so many other aspects of the pandemic. So, what exactly do these passports entail, and what are the specific points of contention around them? That's the topic of this week's Healthcare Triage. Sporting events like the Summer Olympics, ticket distribution companies like Ticketmaster, and cruise lines are among those planning to require proof of COVID 19 vaccination before people can attend their events. This policy is already in place in Israel, where individuals who have been vaccinated or are immune after recovering from COVID 19 are allowed to use facilities like gyms, whereas their non immune counterparts are left to their own devices. Other countries, like Iceland, are allowing non citizens to enter without screening or quarantine if they have proof of vaccination or prior infection. So, given that we're in the middle of a worldwide pandemic where every susceptible host contributes to spread and every person we vaccinated helps us get out of this, what on earth could be the problem with offering proof of vaccination? It ensures public health and safety. It gets the economy restarted, and it helps us get further down the road to the normal we've been missing. But some have expressed concerns. One common one has to do with government overreach, which is often brought up in the conversation surrounding vaccines. It is important to note that while the US government is trying to support private sector initiatives on those efforts, they have explicitly stated that there will be no federal vaccination database and no federal mandate to be vaccinated. Part of the issue may be the name we've been using, vaccine passports, because passports are documents issued and guaranteed by governments, which is different than something that certifies vaccination or immunity. Similarly, some are concerned about privacy. Many people want to know where their vaccination information will be held and who will be able to access it and the personal data attached to it. However, a recent JAMA article on whether so-called vaccine passports are lawful and ethical points out that these passes would require very little medical information outside of vaccination status and are unlikely to violate privacy laws like HIPAA. When considering these objections, it's important to also consider that proof of vaccination is not a new concept. We've required this proof for years for things like military service, school attendance, travel to certain countries, and for people immigrating to our country. This has usually been accomplished via non-electronic means, such as the so-called yellow card, used by some countries to ensure that travelers have been vaccinated against diseases like cholera and yellow fever. Proof of vaccination has been around almost as long as vaccines have. Another major concern is centered on inequities. Richer countries have been able to purchase and administer far more vaccines, meaning citizens of less prosperous countries, whose vaccine scarcity is partially due to rich countries buying up more of the supplies, will be left behind for a time while their economically advantaged counterparts enjoy travel and other privileges that we've all been missing. The concern over inequity applies within countries as well, including our own. Given that proof of vaccination, like those yellow cards we mentioned, can and have been faked before, many of the plans to prove immunity involve the use of a smartphone app, and not everybody has one. According to the Pew Research Center, 15% of Americans don't own a smartphone, and ownership rates are lower in certain groups, including those over the age of 65 and those with lower educational status and income. This could become an especially thorny issue if proof of vaccination is needed to access critical spaces for things like healthcare, a space where disparities are already a major issue. There are also individuals who can't get the vaccine yet, either because they aren't yet eligible, don't have reasonable access, or can't take it for medical reasons. There are, of course, ways to work around all of these things and ensure that equity is a top priority. But the concern is that no one is thinking of those workarounds as they attempt to roll out these plans. We also don't want to bully anyone into taking the vaccine if they have real concerns. We'd rather employ resources to help address those concerns appropriately. And there are other things to be considered as well as we figure out how to limit the spread via the use of vaccine credentials. These include taking into account how long immunity lasts, how to track booster shots, and how to make sure the system doesn't get used inappropriately in any way. While we understand that the idea of having to take a vaccine to enjoy everyday privileges feels like an assault on one's rights to some people, we also understand that, as the JAMA article I mentioned puts it, unvaccinated individuals don't have a right to impose risks on others and impede the return to normal activities. We are coerced into many things in exchange for privileges we hold dear. For example, if you're pulled over, you must present proof to the officer that you've taken and passed a test demonstrating your ability to operate a motor vehicle. You must also present proof that you have paid to insure the vehicle. Failure to do these things can result in your being unable to participate in the privilege of driving. Some policies are in place to try and protect people from the consequences of other people's potentially risky decisions. As a channel focused on good public health policy, we're in favor of well-thought-out systems that contribute to such protections, including this one. Hey, did you enjoy this episode? You might enjoy this previous episode on AstraZeneca's vaccine and blood clots. We'd really appreciate it if you liked the video and subscribe to the channel down below, and consider going to patreon.com/healthcaretriage, where you can help support the show even during a global pandemic. We'd like to especially thank our research associates, James Glasgow, Joe Sevitz, Josh Gister, and Michael Chin, and of course, our Surgeon Admiral, Sam.